Welcome to an occasional conversation about Indian country and healthcare reform. I'm Mark Trahan. Senator Edward N. Kennedy jumped into American Indian issues with zeal after his brother Bobby was assassinated. Senator Robert F. Kennedy used the Indian Education Subcommittee as his platform during his extensive travels across Indian country with the Anti-Poverty Tour. A young Ted Kennedy wrote in Look magazine that RFK saw, as I have seen, the resilience of the Indian way of life, a way of life that has for many generations resisted destruction despite government blunders that almost seemed designed to stamp it out. In October 1969, Kennedy attended the National Congress of American Indians meeting in Albuquerque and called for the establishment of a Senate Select Committee on the Human Needs of American Indians. The young senator blasted away at the Nixon administration. Quote, "We need no more presidential task forces. We need no more buck passing. We know where the blame lies. We need no more empty promises. We know they are empty," he said. A few months later, Kennedy joined Bobby's widow, Ethel, at an NCAI banquet. He promised to champion the Native cause and to turn to American Indians because self-determination is the best solution. But in the Senate, there were competing ideas about how to make self-determination the policy of the land. One specific challenge was the Indian Health Care Improvement Act. Quote, "The more serious threat to the bill came from Senator Edward Kennedy, a Massachusetts Democrat, or more accurately, from Kennedy's staff. As chairman of the Health Subcommittee, Kennedy asked to share jurisdiction over Indian health legislation," wrote Dr. Abe Bergman and his co-authors in A Political History of the Indian Health Service. Had the bill gone to Kennedy's subcommittee, there likely would have been little or no Republican support. At the Interior Committee, however, there was growing bipartisan view that the bill was necessary. Rick Lavis, who worked with Arizona Senator Paul Fannin, said he had to sell his conservative boss on the cost of the legislation, $1.6 billion. "It's costing how much?" Fannin asked. But the facts on the ground overwhelmingly supported the case. Lavis said the Indian Health Service was in total disarray, not as an organization, but in terms of its facilities, its manpower, its ability to deliver health care. Republicans also liked the idea that the health care improvement bill satisfied treaty obligations, rather than just being another big government anti-poverty effort. Forrest Girard, working for the Interior Committee, and his chairman, Senator Henry M. Jackson, arranged for a public forum with Kennedy and the National Indian Health Board. Mel Sampson from Yakima agreed to ask, at the appropriate time, if Senator Kennedy would forego jurisdiction so that we might pass a bill. Girard said, amazingly, he agreed to do that at that meeting. I don't think his staff was too happy about it, Girard recalled, but he called it a godsend. Girard added this week that Kennedy's experience as a legislative tactician recognized the importance of a bipartisan support. He also recognized that this move would ensure that certain amendments that he deemed critical, particularly on mental health, would be approved in the legislation. The result was the Indian Health Care Improvement Act, and it was signed into law October 1st, 1976. I was thinking about this story during Senator Kennedy's funeral. The list of his accomplishments is long, and he is well deserving of the honors that come from every corner. But I also think Kennedy's greatness ought to be measured by the act of stepping aside at a critical time. The passage of the Indian Health Care Improvement Act then, and again now, was more important than any credit a single senator could gain by occupying center stage. The story also seems to be relevant to the current healthcare reform debate. The American Indian healthcare system is different than that of the rest of the country, and it's a complicated structure. Healthcare reform on a national level will have unintended consequences, ranging from new insurance requirements to a better or worse process for Medicaid and Medicare reimbursements. That's why it's so critical of tribes, Native organizations, and the congressional committees with a unique understanding of American Indian history and policy to have a final say on healthcare reform. Even better, Congress could reauthorize the Indian Health Care Improvement Act and adequately fund the health system that the U.S. government already operates. As Senator Kennedy put it, we need no more buck passing. We know where the blame lies. Thank you.